Hello, hello, hello. Welcome to the Efficient Practice Podcast. I am your host, Dr. Evelyn Samuel, and I am super excited about our interview today. We have an outstanding guest on the show today. We have Dr. Rico Short. Welcome to the show, Dr. Short.
Hey, thank you for having me.
Absolutely. We're so excited to have you here. The listeners are in for a treat, so you definitely want to stay to the very end of this episode. Dr. Short is going to be dropping so many pearls of wisdom, so you don't want to miss out. But before we get started, if you have not, please join our free Facebook. It's called the Efficiency Now Network, where there are several dentists and other dental professionals. We're all in there trying to help each other. So if you have efficient practices, like dental practices or medical practices, or if you're using efficient practices to run your business better, that group is for you. And if you have not, please subscribe, rate, and review the show. It's called the Efficient Practice Podcast. So before we get started, I am going to read a little bit about Dr. Short's very impressive bio. So Dr. Rico Short attended the Medical College of Georgia School of Dentistry, the Dental College of Georgia, to attain a Doctor of Dental Medicine degree in 1999. In 2002, he earned his postdoctoral degree in endodontics from Nova Southeastern University. Dr. Short added the final notch to his belt and became a Diplomate of the American Board of Endodontics in 2009. His private practice, Apex Endodontics P.C, was opened in 2004 and is located in Smyrna, Georgia, just outside of Atlanta. Dr. Short has almost 20 years of experience in dentistry and over 15 years in endodontics. He is an expert consultant in endodontics to the Georgia Board of Dentistry and a assistant clinical professor at the Dental College of Georgia in Augusta. He is an independent national lecturer and is endorsed by the American Association of Endodontists Speakers Bureau. In addition, he has treated numerous celebrities, from actors, producers, writers, comedians, television anchors, sports athletes, and music artists. He is affectionately known as the Root Canal Specialist to the stars. Dr. Short has written articles and published in several journals, including Dentistry Today. He made the exclusive cover in April of 2013. Inside Dentistry, Upscale Magazine, Rolling Out Magazine, and the Journal of Endodontics. He has lectured at the American Dental Association and the National Dental Association annual meetings, in addition throughout the United States and the Caribbean. Dr. Short's work has been published in dental journals around the world, with opportunities to speak in China and the Philippines. Furthermore, Dr. Short has a very robust online presence in dentistry. He has over 3,000 followers in LinkedIn worldwide and over 10,000 followers on Facebook explaining various dental procedures and current trends in dentistry. Dr. Short was named one of the top 40 dentists under 40 in America by Incisal Edge magazine in 2013 and has been named in Dentistry Today consistently as one of the top leaders in continuing education. He is a frequent contributor to online dental journals as well. In addition, he has made several guest appearances on local and national radio, television shows, and stations. In 2012, June of 2012, he spoke on Trinity Broadcast Network to over 80 million households worldwide, dispelling myths about root canal therapy and optimizing oral health. Dr. Short has received several prestigious awards and accolades throughout his career. He is very philanthropic in his community. Dr. Short has established an annual scholarship at the Dental College of Georgia in Augusta, formerly known as the Medical College of Georgia School of Dentistry. He is an American Dental Association success speaker and a graduate of the Institute of Diversity and Leadership program. With this knowledge, Dr. Short travels around the country speaking to senior dental students about the future of dentistry. In addition, he volunteers at various nonprofit nonprofit organizations, and charity dental clinics. In October of 2012, Dr. Short was selected as a panelist for the Affordable Care Act. He was invited to the White House to give his personal opinion about how the Affordable Care Act would affect both businesses and citizens of our country from a healthcare provider perspective. Dr. Short is also a motivational speaker and author. His new book, entitled Getting to the Root of Your Problem, 365 Days of Inspirational Thinking, is considered one of the most thought-provoking self-published books today. He travels abroad, teaching people to tap into their God-given potential to make a positive difference in society. Dr. Short is married to Angela Short, who is a dental hygienist, and they have two beautiful children, Jayla and Ava. Welcome to the show, Dr. Short.
Oh, thank you for having me. Man, I was listening to him like, who is that guy? I don't even know who that guy is. So, we just get caught up in the moment, you just do it. And I'm proud of what you're doing. I want to call you Evelyn because I've been knowing you a long time, Dr. T. But I'm proud of what you're doing and the impact you're making in dentistry as well.
Thank you. And thank you so much for coming on the show, Dr. Short. And I'm going to refer to you as Rico because, yes, we know each other and we go way back, and we're going to talk about that a little bit on the show. But yes, thank you for being on the show. You've done so many amazing things, and I cannot wait for the listeners to hear all about the things you've done, all about the exciting things you've done in dentistry and how you help in the community and how you inspire so many people. So I can't wait to get started.
All right.
Before we dive really deep into your interview, I'd like for you to, I can't imagine the viewers don't know you because you've done so many things and you're such a well-known trailblazer in dentistry right now. But for those of the listeners who may not be familiar with you, can you tell us a little bit about yourself and your journey and how did you get into dentistry?
Sure. Well, I'm going to try to make the long story as short as possible. So I'm from Columbus, Georgia, small town outside of Atlanta, about 2 hours outside of Atlanta. And I was reared in a single parent household, never knew my father, no one went to college. My mother was a mill worker. And around me, I had hardworking family, but no one aspired to get outside their neighborhood. And one day, I actually was fortunate enough to get involved in a mentoring program. The mentor happened to be a dentist. And so he came to my community, came to my home, and basically was a kind of a father figure to me. And he showed me what it was like to actually have a dental office, to be a dentist and doctor, because a lot of people think dentists aren't doctors, but we are. In fact, we do a lot more than most doctors do, but I didn't say that. And then I wanted to see what it's like, to live outside of my neighborhood. And he lived in a country club and had this nice home and all those kind of things as a young African-American male. That was something I had to relate to. I had to put my eyes and my hands to it. And once I saw that, that sparked something in me to work hard and to be something other than what I saw the people in my neighborhood was doing. And so he sparked my interest in dentistry. And this is all the way back in 10th grade in high school. And since then, I kind of knew what I wanted to do. And he became my mentor all the way throughout. I went to Morris Brown College, and I finished Morris Brown in 3 years. And then after that, I got accepted to dental school at the Dental College of Georgia now, or the Medical College of Georgia School in Augusta. And it was a pretty difficult transition. I was the only African-American male in my class, and I had to learn how to speak the language. And so some of you guys probably say, hey, Doctor, what do you mean the language, the English language? Well, it's a different environment. And if you don't know how to adapt to that environment, it's going to be very difficult. I tell people all the time, it's like taking somebody from the hood or from the other side of the tracks, and you sit them and let's sit them down and watch Seinfeld. Well, guess what? They're not going to get that dry comedy because they're not used to it. So that was a language I had to get used to, and it took me a while to get used to that. And a lot of people there thought I was there to probably, meet some type of quota. And in the South, racism still existed, and I excelled, and some of my professors thought that I was cheating and things like that. So it was pretty difficult there. But I said I would stay focused, just like the sign behind you say, stay focused, and I would finish the journey. So I finished the top of my class, and once I finished, I actually practiced general dentistry for a few years with my mentor back in Columbus, and everything was great at first. The first year was great, and things start changing. There was a little kind of jealousy, I thought, that set in, and it made me, I was uncomfortable. We may go into that a little bit, and I wanted to do something else, and so I ended up looking at becoming an endodontist and going back to school. So I ended up applying and got into the program, which is a whole long story of how I got into the program. It was really by the grace of God that I got into the program, and fell in love with endodontics, and came back to Atlanta and worked for a group for about 3 years and opened my own. So this month, I'm actually celebrating my 15th year in my own private practice that I actually started from scratch. Did not buy into a practice. I actually started opening the door and knocking on other people's doors and say, hey, look, I know you don't know who I am, but trust me, I can do a pretty good root canal. And it just started growing from there. And, that little spark turned into a love and a passion. And the next thing you know, I was writing articles and doing lectures and volunteering. And I ended up becoming an associate professor at the school that I kind of hated. And I actually went back and been able to speak to the students with a smile on my face and talk to some of the professors that never think I was going to make it through dental school, furthermore become a specialist, furthermore become a professor, and add another notch onto it, given a scholarship in my name at the institution that they didn't even think I was going to make it through. So I tell people, the best, revenge is massive success, and that's what, by the grace of God, I've been able to accomplish. So now, got 15 years in, I'm in my own practice in Smyrna, Georgia, right outside of Atlanta, and been able to contribute online to social media to try to help other dentists to do a better root canal or how to make the proper diagnosis. And if I'm not doing that, I'm telling you, just giving you tips on how to live, how to be able to be a really good father or a great husband, and to be able to stay grounded in your faith. And it's been a wonderful journey so far, Evelyn. So thank you for having me.
Absolutely, absolutely. You just said so many things, and there's so many things that we can talk about. Like we said when we came on the show, we know each other, and we go way back, many years. And I'll just share this with the listeners. We met way back in when we were in college. We did a summer program at Marquette University, and it was a summer dental program. And I met you all those years ago. Several of us went on to become dentists. But I remember you, and you never know what impression you make on people. But I remember that I thought you were just really bright. I thought you were exceptional. I did. I remember that, and I remember a lot of people that were participating. But I just thought he is so sharp.
Oh, thank you very much. I appreciate that.
I did. I mean, I'm serious. I did. And so now that you have done all these things, and you're on a lecture circuit, and you're lecturing all over the country, and you're in all the journals, it didn't surprise me at all, because I remembered that about you when we were in that program.
Oh, awesome.
Yes. So I too can relate to what you were saying. I went to the University of Alabama School of Dentistry, and I went to Alabama A&M University for undergrad, which is an HBCU. So I too had to go into that transition. And it's very difficult to explain that to people who may not have experience, like the HBCU experience. There was a camaraderie there that I cannot even explain, And so I too, when I went to dental school, had a time transitioning, but most people wouldn't have known that, because I would never say anything, because I didn't want to appear negative.
Right, absolutely.
So I just kind of struggled in silence.
Right.
So for for maybe dental students that may be in school and they're aspiring to be an endodontist someday, is there any advice that you could give them in terms of how to deal with, coping with it? Because dental school is tough anyway. You have that, and then you have this added learning the language. Is there anything that you would recommend or advise to students that are going through something similar?
Absolutely. Well, number one thing, you have to get a mentor. If you don't get a mentor, it's already tough. It's going to be like hell. I mean, I'm just going to be honest with you. You get a mentor, and I'm not saying somebody that, you got to be on the phone every day with, but somebody you can call every now and then to keep you focused, to keep you encouraged, and lift you up. And that's what you're going to need. And also, what helped me too is I had a very, very good study partner. And if you are a dental student, you need to have you a study partner. And guess what? Your study partner may not look like you. I didn't have a big selection of who my study partner could be because he wasn't the same, skin color and didn't come from my block. But my study partner was actually a Jewish guy. And many people didn't know that he was Jewish. And what happened was one day we were in biochemistry and we were kind of talking, and they like to kind of test and see if you know something. So he asked me a question and I answered the question. He's like, "Nah, I don't think that's true." And I said, "Well, it's on page 46, the second line in the second paragraph." And he said, "No, it's not." And he flipped and looked at it and it was right there. He said, "All right, you're my study partner for the next we're going to do this." And he ended up becoming a really successful orthodontist in Oregon. And the thing is, with me connecting with him, he actually saw a lot of struggles that I went through. He saw and there were some clinical things where the highest grade I can get is a C, or turning in projects like wax ups and things like that. He's like, "Man, yours look just as good as mine, but it's supposed to be double blind." Well, I knew that they knew whose dental form and things like that it was. And I struggle with that, but academically taking the regular test, I did well because you can't really, that's not as subjective. And so one day I remember me and him, we switched dental forms on something. So when we switched dental forms, he still got an A and I still got a C.
Wow.
That's what showed me right there my sophomore year, like, okay, the playing field is not level. And he said, "Hey, I got your back. If anything crazy happens, I'm going to vouch for you." And I really appreciated that, and especially on this MLK weekend where we look out for each other. We look out for fellow brothers and sisters who may not even look like you. And I was appreciative that me and him, we're still really good friends till this day. And but he asked me, he said, "Well, how do you handle that? You have to do things 2 and 3 times over." I said, "You know what?" I said, "It's going to make me better and it's going to make me stronger." And guess what? When I got ready to take my my clinical exam, I aced it because I had to do things over 2 and 3 times. When I got out to become a general dentistry, I didn't have to do a GPR or anything like that because I almost did that in school. I had to do things multiple times over. And where they thought they were hurting me, they actually was helping me. So some of you dental students, if you're in that category, you feel like you're getting kind of picked on and things like that, just remember, as you're doing these things multiple times over, they're not hurting you, they're really helping you. So those are 2 really strong advice I would give the dental student today, as far as coping through dental school. If you feel like you're being singled out, you feel like you're not being included, just make sure you have a study partner. And like I said, they may not look like you, and that's okay. And number 2, make sure you have a mentor, because the mentor is going to help you see the other side, because you got to be able to see the now and you got to be able to see the future. You can't see the future. You can get so bogged on the now, and then that can make you, give up or want to quit.
Right. Good answer. Good advice. So you've been in your practice for, you said 15 years. This is the anniversary.
Yes, this month, by the grace of God.
Congratulations.
Thank you.
So yeah, being a practice owner and starting from scratch is always, there's a lot involved. So that's to be commended. And I like for the show that there are all kinds of people listening. The majority of people will probably be dentists, just because I'm a dentist. I'm going to attract some dentists. But I like to have business owners who have done well in business on, so that we can share business tips to help whatever business you're in to run better. So what would you say is some of your efficient practices that you use in your practice that kind of helps you to have a very good and productive and profitable practice?
Well, I mean, it's so many nuggets I can drop, but one of the main thing is to, you know, streamline, stay efficient. You know, you don't have to buy the newest thing that comes out. Dentistry changes so fast. If you keep buying all the newest stuff that comes out, number one, you won't ever be able to keep up with the technology. I'm trying to tell you that. And number two is the fact that you're going to keep putting yourself in more and more debt. And really, number three, you won't be able to master it. And I tell people, you know, once you get your technique, once you get your, you know, your items down, you master it. And I'm not saying not to change. Definitely, you can change as you see fit. But when you start changing too fast, then you start getting in all this debt, and you start piling up. I call it junk dentistry. You pile up all these things that you don't need. So first of all, I would say, you know, you master your craft and you streamline to the things that you need, and then you stay focused on that. And then as you get better and you learn more, and I always recommend going to continuing education courses, as many courses you can take, but make sure that's for you. And I see so many people fall in the trap of, that person got this, now I got to get this, or that person got this cone beam, I got to get this, or I got to get one better than them, because they're so trapped in the competitive mindset. And there's nothing wrong with being competitive, but you want to be competitive with yourself. You don't want to be competitive with everybody that's out there, because you're going to fall into a rat race. And then you're going to find yourself, you got the new stuff, but guess what? Now you have more debt. And every time you get something else, you got to learn it and then master it. And then it's going to always be something else out there. So I tell people all the time, you know, once you kind of get your sweet spot, because everybody have one, you carve your own niche out. You know, if you are very good at doing cosmetic dentistry, what the heck you doing root canals? I mean, you shouldn't even be messing with a root canal. It's going to throw you off. It's going to waste your time. You're going to lose a lot of money. Send it out. I don't care what practice management person says, hey, you don't need to send all this stuff out. You need to keep it in your house. Trust me. If you want to do it for a long time, enjoy it, focus on the things you love. And, you know, trying to be, you know, all these other things in dentistry. I was a general dentist. You know, I was a general dentist for 3 years, and it was so much stuff to try to remember. I mean, you got a crown prep here, you got a filling here, you got a check hygiene, then you got a root canal there, then you got extraction, then you got a surgical extraction. And then now you got an implant, you got all this stuff, and it's hard to juggle all that. I mean, and then you're talking about juggling it and then staying high quality. Guess what? That does not mix. You can't juggle all these things and stay high quality and efficient. It doesn't work like that. So you have to find those things you love, find those things you're focused on. You focus on that, and all the other stuff, you can just send it out. And it's okay. You can do that. And if you listen, and this is another thing, Evelyn, I'm gonna call you Evelyn.
Oh, that's fine.
You know, a lot of times, you know, people, you know, I sit back in some of these, you know, lectures, and the first thing they tell me, you know, well, Dr. Short, what's your best file? Or what's your best hand? What's this? And I'm like, look, you know, what's best for me may not be best for you. You know, I tell people all the time, if you're trying to get from where I live to Atlanta, you can get there various means. You can drive a Mercedes, you can drive a Bentley, you can drive a Toyota, you can ride a bike, a skateboard. You know, there's different ways to get to the end. It all depends on how you want to get there and what do you want to invest to get there? Because, you know, I talk to people all around the world, and guess what? There are some areas around the world, like in certain parts of Brazil, certain parts of Africa. I talk to people in certain parts of Australia. They don't have access to the things we have, or they don't have necessarily the finances to go out and buy a cone beam machine and all the finest implant equipment and all that. But guess what? They can do a really good job with the stuff that they have. And they asked me, they said, we come to the United States, or we listen to other people, we feel so bad because we can't afford to buy those things. I said, look, don't worry about that. As long as you're doing the best quality dentistry you can, it doesn't matter. And so once I tell them that and they get it, you know, it takes the stress off, number one. And guess what? It takes the financial burden off. number two. And number three, the key is to be financially free, financially independent. Have your student loans paid, pay off your practice. Once you do that, whether you got 20 people coming or you got two, guess what? You're gonna be fine. You get off the rat wheel. And that's what I try to tell people. Once you get down to that point and you pay off the debt and you're smart with your money, invest your money wisely, you can enjoy dentistry, because dentistry is meant to be enjoyed. And a lot of people, they don't understand that. And they put all that pressure on, they buy all this stuff and do those kind of things, and never can get a chance to really enjoy dentistry because they're trying to keep up with the Joneses in one shape, form, or fashion.
Well, I am the endodontist best friend because I refer all molars out, and I have always referred all molars out. I couldn't agree with you more. I found out very early on that I love crown and bridge and the cosmetic things. And so, like you said, I felt better doing the things that I like to do and that I was proficient and efficient at, and I could do quickly and be more productive and do beautiful dentistry than to attempt to do a molar root canal. It started off though, we were at Alabama, we had endo residents. Mm-hmm. So we didn't really do molars in dental school. So the molars were for the residents. And so I took that same thought process when I went into private practice, and I felt like the molars were for specialists. And I think I attempted to do one maybe once, and it took so long that I would tell patients, you really don't want me to do a molar root canal. Let me send you to my friendly neighborhood endodontist, and I will do you a beautiful restoration afterwards. And all was well with the role. So I agree. And you're right. A lot of practice management companies will say, well, you got to keep everything in, and you got to be good at everything. And it just makes for a stressful environment. It just makes for a stressful environment as a dentist trying to do all those things. So I couldn't agree with you more. And I've gone into several practices in different states, and I've seen people just seeing so many patients, in a day, and they're like, this is the only way. And I think you should just do what you love to do and become very proficient at it, like you said, and you'll do a better job, you'll do better dentistry, and you'll feel less stressed as well.
Absolutely. And the patients are going to be able to feel that energy from you. They'll be able to tell, wait, man, you know what, Dr. Teak, she loves doing this. And guess what they're going to do? They're going to tell somebody else. And then next thing you know, you're going to have people coming and see you, and you're not spending thousands of dollars on all this marketing stuff. And I'm not against marketing. Do what you got to do. But nothing is better than word of mouth marketing, and someone tells somebody else about the positive experience they had with you. And once you're able to do that and deliver the product, and they feel that you love what you do, you're going to find yourself having, plenty of patients, and not only just patients, they're going to be high quality patients, because there's a difference between a regular dental patient and a high quality dental patient. And as a dentist, you want to have high quality dental patients. And I know you know a lot about that, right?
Yes, indeed. Yes, indeed. And you are so, so, so correct. So you are also affectionately known as the Root Canal Specialist to the stars. How did that happen? I know you have your own patients, and you've had your practice for about 15 years, but how did you get into this role? How did you become like this source that celebrities and people come to you for their dentistry?
Well, being in Atlanta is kind of a hotbed for a lot of things that goes on. So, but back up when I was at Morris Brown, a lot of my good friends, and some of them I went to high school with, they started off in college, and then there was like, you know what, we want to do something different. So a lot of my friends, they actually interned with LaFace, L.A. Reid and Babyface. They had their, big studio here, and they birthed people like Usher and, Pink and Outkast and all those kind of people like that. And so I actually hung out with them. Like when they were like, people didn't know who they were. We all hung out together at the Atlanta University Center with Morehouse, Clark, Spelman, Morris Brown. And so when I became a dentist, I was still friends with these people. And then when I did my residency down at Nova Southeastern in Fort Lauderdale, they would bring all the artists there. And sometimes they say, hey, you know what? You have a nice place. Hey, how about Pink or whatever, just crash at your place? I'm like, sure, yeah, we all can hang out here. So I got to know these people personally. It's like, hey, you know, whenever you come out, you come back to Atlanta, we're going to look you up. So I'm like, yeah, right. And so it actually happened. And so when they needed a root canal, they were like, yeah, I remember this guy, you know, Dr. Short, you know, let's go and check him out. So one of my first celebrities that I worked on was Usher Raymond. And he was scared as all get out. And then unable to do a root canal, and he like fell asleep while I'm doing the root canal. It's like, hey man, why didn't I have those experiences with other people? I've had other root canals before in Beverly Hills and things like that. But for you, I didn't feel anything. Man, that's awesome. That's amazing. I'm going to tell everybody about you in the industry. So some of the people already knew me. And then when he said, okay, I'm going to tell some of those people. And then the floodgates opened up. And then one of my good friends, his name is Farnsworth Bentley. Um, he had a show called G's to Gents. Some people affectionately know him as being P. Diddy's personal assistant, the guy that carries the umbrella.
I remember that.
Remember him, right? So he came by and, you know, he was like, hey, man, you need to call yourself the Root Canal Specialist to the stars. And I'm like, man, that's kind of cheesy. He was like, trust me, you already send the celebrities. Trust me, I live in LA and they capitalize on everything. You call yourself that, they're gonna make fun at hey, why you in the beginning he said, but when you look 5-10 years down the road, that's gonna be who you are. When you ask Siri who's the root canal specialist of the stars, or Dr. Rico Short, and they're gonna be like, wow, why didn't I think of that? So I did it, and because of that, you know, I've been seeing, you know, a whole bunch of different, you know, celebrities and all that. And I'm gonna pause here. You know, I treat everybody like a celebrity.
Exactly.
That's what I do. So just because, you know, a celebrity come through, no matter who they are, you know, I make sure they feel welcome and they feel down to earth, because a lot of them, they don't like all that stuff. You know, they're like, hey, Doc, just treat me like everybody else, you know, and that's what they like. So I'm able to do that. But I treat everybody I see, I treat like a celebrity.
Good deal. Good deal. And so I'm going to ask you some of the questions. You said a lot of people ask you, what file do you use? And,
Right.
and that's going to be some of the questions that
it always is.
It is. And so we have a couple of questions. There are some people from one of the private Facebook groups that submitted a couple of questions. They knew you were coming on the show. Okay. And so I have a couple of questions here we're just going to answer on the spot. So the first one is, does it really matter if warm vertical condensation is used or lateral condensation? And the person goes on to say that I was trained to use warm vertical condensation, but with being a new grad, have come to realize that most GP offices are actually using either a single cone fit or vertical condensation. I know the standard of care I was taught was always vertical condensation. And then she goes on to just say, thank you.
Right. Well, that's a great question. Well, originally, you know, root canals were done with lateral condensation. That means you have a single cone, and then you put some accessory cones, and you put it in there, and you put some pressure, you put it in, put some pressure, and then you sear the top off, and that's it. And guess what? That is still an acceptable technique. Now, would it look as pretty as the one vertical? You can pop the laterals and all that. Maybe not, but guess what? From a success rate standpoint, there's no difference. So if you're using lateral condensation or one vertical condensation, both of those techniques are acceptable. And if you do a great job obturating, you're going to get, you know, a great result. Now, I do have mixed feelings about the carrier-based obturators, like Thermofil and things like that, because I actually retreat more of that than anything else in my practice. And one of the main reasons is the fact that most of the time when they're using Thermofil, which is carrier-based obturators, plastic carrier in the middle, you can kind of cheat a little bit. And what do I mean by cheat? You can inadequately clean out the canal system, and if you shove that thing in there and take a beautiful x-ray, it'll look great. But guess what? There's still some tissue and debris in there. So if it's not adequately cleaned out and you shove it in there, it's going to look great, but that will break down usually in a couple of months or maybe between 1 to 3 years and have to be retreated. But it looks beautiful on the x-ray. In fact, I can look at the x-ray and it looks beautiful and it has a lesion there, a patient swollen. I can already say, I said, that's thermophil in there. And I get in there and that's what it is. And the reason is because with one vertical, you have to fit the cone and get tugged back. If there's tissue in there, there's debris, guess what's going to happen to that cone? It's going to crinkle up. You're not going to get it down. And you have to take it out and do another one. Then you keep getting frustrated. And then either you're going to go back in there and re-clean and shape. That's what you should do. Or you close it up like, you know what, you're going to the endodontist. So either way. So, and another thing is with thermophils, what makes it very difficult for endodontists to retreat is trying to remove the carrier, especially around a curve. Those carriers are very difficult to remove around the curve. It takes a lot of time. It increases the ability to be able to perforate or transport the canal, and some of them you have to end up doing the apical surgery. So I'm not really a big proponent to carrier-based obturators. However, that is the #1 obturation system in the world. Mm-hmm. Why? Because most general dentists use it. I would say 90-95% of general dentists use it around the world. Now, it's not a bad system if it's done properly. But the problem is, if you're under a certain time constraint, you're trying to hurry up and get it done, you're not going to do a good job adequately cleaning and shaping. And then you're going to pretty much pack debris or pack tissue down there with that obturator, and then it's going to fail on you. So that's my take on obturation techniques with when you compare we compare lateral to one vertical to the thermophil or plastic carrier method.
And that's interesting that you say that that's the #1 system that general dentists are using. Because do the statistics say that general dentists are doing more root canals than the specialists? Is that right?
Absolutely. 80% of all root canals global are done by the general dentist. So as an endodontist, we only usually see about 20% of root canals that are done initially, but we normally end up doing about 90% of retreatment. So it's difficult as an endodontist to explain to the patient why they need the retreatment in a lot of those cases without making their general dentist look bad. And so it's a tightrope, and we do a pretty good job at doing that. But usually the patients say, well, why didn't my dentist send me to you in the first place? And so we have to say something, well, your general dentist, you know what? They did the best they could with what they had, the knowledge they had, and we're just going to move on and try to fix it. Did they do anything, terrible? No, they didn't. But, they did the best they could with what they had. And, most of the time, root canals work. But unfortunately, yours didn't, but we'll fix it. So, but they always say, man, well, the next time, I just want to just come to see an endodontist the first place, and that'll be, saving me a lot of time and money. And so, it does. So that's where it is. And again, I'm not saying general dentists shouldn't do root canals, because I've gotten a lot of Facebook flack on that. And I'm like, no, I'm not saying that. What I am saying is if you're going to do it, you have to do it up to our standard. That is the law. That is the standard of care. If you're going to do endodontics, you have to do it up to the same level as an endodontist. And if you ever were to go in front of the board, and if it's not, and then you're going to be in trouble, or Lord forbid, you go in front of an attorney. They're gonna hold you at the same standard of care as an endodontist.
And I would also say just know when to refer.
Yes.
Just know when to refer, because you know how you said you would have to explain. I would have to explain why I was sending the patient out. Meaning, a lot of patients if they develop a relationship with you and a rapport, and they're already nervous, they don't want to go see somebody else. And I would always make a very good case for the endodontist, because like I said, I'd say, you really don't want me to do this. It would take so long. And this person has more instruments and more, they may have microscopes, and they can see things that I may not be able to see. And that's kind of how I would explain it, so that they will feel more comfortable going out because a lot of people just are afraid. You know, they're afraid of us as dentists
Right.
in general. But I see some of the cases that you put up on Facebook, and they are absolutely beautiful. But I'm thinking, why would anybody ever do a molar root canal with, it seems like every last one of them have an extra canal working. And the apex is curved, and like, why would anybody attempt to do that? Like, why would anybody do that? So your cases are beautiful. So do you have straightforward cases? Do you ever do like simple 8-9 interiors, everything these
Yeah,
complex?
yeah, that's a good question. Most of my straightforward cases come from crazy patients. The patient is crazy. I'm like, okay, if I got a straightforward number 9, something's wrong. And usually I have this patient, and they have either this long, crazy medical history, or they're saying that, this toothache is causing their right toenail to fall off, just stuff that you're like, okay, I'm going to spend more time explaining a root canal to this patient versus doing the treatment. And another thing that I want to talk about is there are a lot of patients out here that go to the internet and
Oh,
they want to be a dentist. And
yes.
that they want to be the endodontist, and they want to tell you how to do their job. So I'll inherit some of those. And, or you'll get the patient that is the naturalist patient, and they want everything holistic and all these kind of things. And they ask all these questions, which we don't mind. I take pride in fact, I don't even work on a patient unless they understand what they're getting and why they're getting it. And if they don't, I say, hey, let's just reschedule it. Well, let me help you find someone that can, answer these questions better than I can. And a lot of times, a lot of the patients, will go and they'll look up some of the information about, you're probably familiar with the Dr. Price thing and about, the root canal can cause cancer, or the root canal is a dead organ in your body and things like that. And I have to go and explain all those things and why that's not so. And then they say, oh, yes, it is, because I saw it on the internet, and I saw this particular person that, that died. They had cancer, they had a root canal. And I'm like, well, they had pink fingernail polish on them too. So, so you and then you hate to do that, but you have to reel them in. And most of them I can reel them in, but some of them, they just go on, the way they want to go. And then the next thing you know, the tooth really starts hurting, and they come back and get the root canal.
You get it done.
But you spent 2 hours of time just explaining all those things. And then, the treatment only takes 30 minutes.
Right.
So normally when I see an 8 and 9, I'm like, all right, there's more to this story. The other ones that I would see that's supposed to be straightforward are the trauma cases that can be pretty delicate to handle, or the open apex cases of the kid falls down and they're 6 years old, they got an abscess, the root is immature. Well, what do you do? And those kind of cases are very challenging because it depends on, the diagnosis and the kid and what's going on. It depends on what the mom want to do, whether they want to try to do some epexification or some regenerative endodontics using stem cells and those kind of things. And a lot of times you have to have a very sharp endodontist that knows how to work on kids, because a lot of my endodontic kids, a lot of my endodontic colleagues, if you're not 12 and older, they won't even touch you. So I'm one of the few that will work on kids as young as 6 years old. But I actually had training in my residency at Miami Children's Hospital. So that was a plus. At the time, I thought it was crazy. It was a burden. I'm like, why are we treating these young kids? I'm never going to be seeing kids in my practice, but I'm the pediatric dentist's best friend when it comes down to trauma, because I can handle a lot of those cases because I have training, and I did a fellowship at Miami Children's Hospital when I was at Nova Southeastern in Fort Lauderdale. So, so those are some of the, talking about referrals. So those are some of the interesting gamuts of the referral patients that we see.
Okay. And we have one more question.
Sure.
And this time, this dentist just wrote in, what is your irrigation protocol?
Irrigation protocol, boy, that's another one that I can probably spend 3 hours on. See, Evelyn, I'm one of those kind of people where I'm, I'm an expert, independent consultant and leader in endodontics. And all that means is that, look, I can tell you how to keep it simple, or I can, if you want to make it elaborate and complex, I can do that as well. But I'm a simple guy. I still personally believe in full strength sodium hypochlorite. You know, full strength sodium hypochlorite. And if you use that and you don't focus on speed, it takes at least 20 to 25%, 20 to 25 minutes for sodium hypochlorite to dissolve pulp tissue. So a lot of people, they want to just do this fast root canal. Well, if you do it that fast, you're not dissolving any pulp tissue, and if you're not cleaning out the canal properly, which will lead to failure. So when you talk about irrigation, sodium hypochlorite full strength, no question, that's number one. Number two, you can definitely do EDTA. So my main three are sodium hypochlorite full strength. I use EDTA, and I also use 99% um, ethyl alcohol. And some people say, well, why do you use that? Well, I use the sodium hypochlorite twofold, but to disinfect the tooth, to kill the pulp tissue, because sodium hypochlorite is the only irrigant that can do both. Some of the other ones can't. Now they will sell you chlorhexidine, but guess what? Chlorhexidine doesn't dissolve pulp tissue. So they will sell you all, and I can keep going to. They got all these mixtures of all that kind of stuff, and you can use all that stuff. But really, full strength sodium hypochlorite, EDTA. I use EDTA to help. Well, I actually use it in two forms. The liquid EDTA is a chelator, and it breaks down all the sludge in there, or some people call it the smear layer and all that. And it allows you to have a cleaner canal system so your sealer can bond better to the internal aspects of the tooth. And also some of the studies show that EDTA can also kill funguses actually in the root canal system. Some people are like, yeah, it's funguses in it. I'm like, yeah, there are. And viruses as well. Um, and so also I like to use a final rinse of 99% ethyl alcohol. So people's like, well, why is that? Well, number one, it's a drying agent, so it helps dry, so you don't have to use a million paper points. Number one, and number two, one of my first major research papers that actually got published in the Journal of Endodontics is that if you use sodium hypochlorite by itself, it can form these little crystals, and these little crystals can actually occlude the dental tubules. It could block you out of a lateral canal. So when you use sodium hypochlorite as 99% ethyl alcohol as a final rinse, it breaks that down. And so you don't have to worry about blocking yourself out or not having a really good adaptation with your sealing your gutta percha to the root canal wall system. And secondly, I also use it to sterilize my gutta percha. So people are like, how do you sterilize gutta percha? Well, a 1 minute, um, um, you can irrigate the gutta percha, or you can put your gutta percha in a tray, and you put in sodium hypochlorite for 1 minute. It actually sterilizes it, because gutta percha does not come naturally sterile. And once you open it up, some of the studies show that it can have bacteria films, biofilms, and things like that on it. Well, you want to make sure when you put it inside the tooth, inside someone's body, you want it to be as sterile as possible. So I let it soak with a minute of sodium hypochlorite, and then also I do a final rinse of the 99% alcohol on it to remove any sodium chloride crystals that may form on it. And then you're ready to go. And not only that, guess what? Have you ever had an overfill before? Yeah, I've had an overfill. But guess what? If you do enough endo, you're gonna have an overfill. But guess what? If you have an overfill and your gutta percha is sterile, and you clean the system, you clean the root canal system out adequately, guess what's gonna happen? Nothing. I always tell people a little gutta percha won't hurt you. If you have a little bit outside, now I'm not talking about you blasted out 10 millimeters and you got a curlicue up into the sinus. I'm not saying that. But if you have a little overfill, there's nothing to freak out about. You monitor it, and most of the time, if the gutta percha has been sterilized with the technique I'm telling you, and the root canal system has been adequately cleaned and shaped, and properly irrigation, it won't be a problem. And I've had some studies. I've actually had a case where I actually overfilled, and I followed this case up like 10 years, and guess what? The gutta percha was gone. People are like, how did that happen? Well, without getting into too much science, you feel like I'm giving a lecture now, but the macrophages outside, actually over a period of time, will eat away at the gutta percha because it's inert, and it will eat it away literally, and over a period of time, it may not even be there. Um, so that's just the body, and how sometimes God just designs us to be able to be, that awesome, even with.
And it's something, because you said at some point you may have a little bit of an overfill, and at some point you're definitely going to have an instrument to separate. It's just how it works when you're doing the procedure, right?
Absolutely, absolutely.
Yeah. So I want to get into a little bit before we conclude, because we're talking a lot about the science part, but there'll be other people that'll be listening to the show as well. Your book, it is Getting to the Root of Your Problem, 365 days of inspirational thinking. So what made you write that book?
Well, that's a good question. That book was actually birthed out of a lot of Facebook posts. I post daily inspirational, my daily inspirational word, and now I've actually added a short video inspiration and talk about a lot of different things. And someone said, "Hey, you know what? You need to write a book." I'm like, "I don't have time to write a book. Like, what are you talking about?" And they said, "Well, you already written a book. You've been talking on Facebook for 3 years and you have all these posts. Have you ever heard of purpose-driven life?" I'm like, "Yeah, I read it. I have it." It's like, well, it's just like that. It's like a daily inspirational journey. And you talk about a lot of things that are biblical related. You also talk about your personal life and how you grew up. You also talk about some of the philosophical things like Socrates and Plato and some of the things that Aristotle, some of the things that they said, and you just put it all together. And so that's what I did. I had no idea what I was doing. I contacted a publishing company and they said, "Hey, we like this material. We think it's a great play on words. You're an endodontist. You're saying get into the root of your problem. I think that's going to cross well with your audience." And I put it out there, and they liked it. And it actually, really did awesome and still doing well. It's at Barnes and Nobles and Amazon and even iTunes bookstore picked it up, and it's sold globally. You can download it to an iPhone and all that, and or what do you call it, the tablet thing and all that kind of stuff. And it's really time for me to do another one. Time flies. I think I wrote that book about 4 or 5 years ago, but when people read it, they said it's still fresh, and that's why I know it was birthed out of the heart of God, because His word is fresh and new. Every time you look at it, you were like, "Man, I didn't see that," or "Man, how did He know I was going through those kind of things?" Because these are things that basically is the foundation for my success. And I said I'm going to put it in the book form, and people are asking me, they're waiting for the next one, and I'm like, "Hey, when I get the time, or when God puts in my heart, we're going to do it, because I got so much more, to just pour out." And not only in book form, in that, I have a lot of information I want to share, dealing with what I do as an endodontist, and how I can make other dentists' lives better, and being a better, doing root canals better. So there's a lot of things that I want to do, and still got to be a father to my 2 daughters. I have 11 and 12-year-olds. Still have to be a husband to my wife, and all those kind of things. Is trying to find the time to juggle all those things. So that's the most difficult part. It's like so much time a day, and you get so many opportunities. You want to do so many things, but you gotta, as your sign, stay on the top of your head, stay focused. And so that's what I have to do.
Well, good. I can attest to those inspirational posts that you put on Facebook. I think I've messaged you, and sometimes I comment on them, but sometimes I feel like you're just talking directly to me. And so I really like those. You have inspirational things. You have things that are spiritual or biblical. And like I said, sometimes I read them, I'm like, wow, he's talking to me today. Love this post, like that post. So that's really good. So keep up the good work. And also, now, I know we're kind of moving around, but I just want to cover so many things because I have you on here. And I know, like you said, you're busy, and we're juggling everything, and we have so many things. But I want to touch on just one more thing. So you actually are speaker, an American Dental Association success speaker. What
That's
does
correct.
that entail?
So basically, I actually go across the country to different dental schools, and I talk to them about various topics, what the dental students may be interested in. So next week, next Friday, I'll be at Howard University, and I'll be talking about leadership in dentistry, how to basically practice management, and I think the other one is managing debt. I think that's the other one. So basically, it's a program that the ADA offers. You have to apply, you have to interview, and then if you get in, you actually become one of their speakers, and you travel around to dental schools and talk to the dental students about various topics. I think we have like 7 topics that we discuss, and try to help them. And again, this is all volunteer, so I take a day from my schedule. So I wouldn't really recommend it to someone who's really trying to grow their practice, because they pay me a whole $75 a day to do it. So, no, I take that back. I think it's $75 a day, and they do pay your expenses. But at the end of the day, the deposit you have into the students is it's life changing, and you can't put a price on it. I had many students throughout the years say, hey, you came to my dental school and you said something that impacted me, encouraged me, or even made me laugh. It's like, we had all these other speakers coming in, were boring, but when you said, hey, your first dental assistant, she came to work sleepy and all the other kind of stuff, you found out she was a stripper at night and a dental assistant by the day, like that just was so funny to me. And I was like, okay, cool. And I had their attention the rest of the time. And that is a real story. I cannot make that up. So, things like that happen. And when you run your own practice and you just start from scratch, you're going to get you're going to learn, you're going to get all kinds of different people. So it's, for me to take that time to basically be a mentor to some of those students who don't have one, because when I go to the dental schools, I give them, my personal email, and they can contact me, and those who don't have a mentor, and I stay in contact with a lot of students throughout. And so I become a mentor or a person that they can contact, when they're dealing with various issues or when they get out of school and things like that. So that's the ADA success speaker side. I'm also an ADA spokesperson as well, just for the field of endodontics. So when crisis happen or someone, Lord forbid, die having a root canal in a chair, I'm the person that the ADA contact, and I'll be in various media outlets like CNN or Fox or whatever, and explain from a endodontist standpoint what could have happened, or if a patient, you don't use a rubber dam. Believe it or not, 80% of dentists don't consistently use a rubber dam during a root canal. And then they aspirate a file. A file goes down the throat. Then you have to have emergency surgery. That patient sues and all that. Guess who they're going to call? They're going to call Dr. Short, get up there and talk about that. And so I don't want to get that phone call about anybody who's listening to me right now, all right? Because you don't have an excuse. Yeah. Dr. Evelyn had me on her great show. They keep y'all out of trouble as best as she can. So those are two of the, and this is volunteer as well, positions that I have with the ADA. And just as a caveat, they like that. And then they said, hey, we would like you to be one of our speakers. So I have an opportunity to speak at a couple of the national ADA meetings. And again, I wish there were more minorities speaking. And unfortunately, I don't know if we haven't gotten a call or gotten an opportunity or things like that. In fact, I got an email from someone that said, hey, I looked at the cover of Dentistry Today at 2019 top CE leaders. Why are you the only African American on the cover? And it's like, I don't know, 250 dentists on there. And I was like, man, yeah, it's an honor, but something isn't right, because I know there are plenty other great qualified African American dentists out there that they're ready to go. So I'm doing my part to help a lot of people who want that stage and platform get an opportunity, because I would love to have someone right next to me, just like you, Dr. Teague. I would love to have you right next to me on the cover of the magazine, or we can do an article together. And I think it'll be great, because people are looking at us, because I get these Facebook private message, say, hey, look, for me to see you on the cover, my heart melt. Me as a young dentist, I even had someone that was an older dentist that was like born in like the 50s. And they was like, man, to see you on the cover, we made it. It was refreshing to be able to see you. And I was actually I think it was in 2000 and I think it was 15, I was the exclusive cover, the Big Dentistry Today magazine. And I asked the editor, and he was like, yeah, he said, you know what? You're the first African-American to ever be on that cover. And this magazine been out 20-something years, and it comes out every month. And he said, I had to actually fight tooth and nails to get you on the cover. And there was a lot of resistance because they didn't think dentistry was ready to move forward in that yet. And he said, but I persevere because I see all the stuff you do, and it's wonderful. You have a lot of cases. People aren't paying you to say certain things. You're not affiliated with any dental company. And I know your story, and it's amazing. And I think you deserve that honor and recognition. And so he put me on the cover of that. And I actually have people that have saved that cover. Some of the older dentists coming down to the Hinman. I know this may sound weird, but they wanted me to sign the cover of that because they said, we have never ever seen this. Like, dude, you like MLK in dentistry or something like that.
You know, I think I still have that one too. I think I still have that cover because it.
Oh, really?
And I think I'm pretty certain I still have it.
Awesome.
I have that cover as well.
Awesome.
So that's to be commended. So, okay. So what's next? Are you going to do a hands-on course for dentists? Is that what's next?
Yeah. So the next thing is, I've been talking to a few people, and they're saying, hey, you know what, it's time for you to do, a hands-on course. So I'm working on that because, a lot of these hands-on courses in which I've attended, they're just basically smoke and mirrors and sales and marketing. And I don't want to do a hands-on course like that. In fact, the kind of hands-on course I want to do, I want to say, hey, you bring in whatever you used to using, and I'm going to teach you how to be better at using that one thing.
Oh, that's good.
And to me, that's the best hands-on course because I'm not selling you anything.
Mm-hmm.
And then I'm going to bring in what I like, and you'll be able to see what I like. And then you'll be able to compare what I like to what you're doing. And then if you want to make a switch or modification, you can, or I can teach you how to be better at using your technique and what you're using. In fact, one of the students or one of the dentists came up to me and said, hey, Dr. Short, which one is the best technique? Crown down or step back? Which one do you like? And I said, well, number one, it depends on the case. But number two, most of the time I do the crown down technique. And I said, why? I said, because as you're crowning down, you open it up from the top going down, you're able to get more irrigants into the canal space. And also the studies show that you have a less chance of instrument fracture. And if you do, the user's going to fracture at the top, we can get to it. But if you do a step back, that's smaller to larger, use a very small file at first. And if a small file gets stuck in the apex, you can't get it out, you're pretty much toast. So, and then you don't get an opportunity to get the irrigants down. So they were like, wow, that makes so much sense. Well, why in the dental schools, they're still teaching the other way? I'm like, I don't know. So it's little things like that. It can make a huge difference in a lot of the cases, especially the cases that most of the general dentists can do, efficiently, and that can do them well. It even boils down to even type of endo supplies you buy, who you're buying them from, how much you're paying for them. I'm going to tell you something, Evelyn. I used to have, when I first came out, I didn't know any better. I bought everything that my residents told me to buy. I'm like, all right, I was paying $1,000 for a handpiece, and the handpiece tore up. You had to pay $400 to get it fixed.
Yes.
And so the handpiece, it'll last you about a year or two, whatever. And I'm like, why am I paying so much for a shovel? I'm like, let me just see if I can get me another shovel. And so I did some research. I looked on eBay, and there was a company that had a handpiece for I think it was like $25. It was a knockoff of what I used. I'm like, you know what? Let me just try it. Let me tell you something. This handpiece has outlasted the one I paid $1,000 for $25, and the light kept. It's like, why am I paying this much money for a shovel? For me as an endodontist, I just need to make a hole. That's it. The patient doesn't care how the hole is made, long as it's done properly and they're not hurting. And so little things like that, I don't pay any more than $50 for a handpiece. Period. period. So, now when I say that in a lecture, because I'm independent, some of the companies, they're like, oh man, here he goes. He's getting ready to toss his business. But guess what? My audience do. It's like, oh my God, that's awesome. And that's just one thing. There are companies out there that sell awesome burrs and files and things like that for a fraction of what we were buying, because what we were taught when we were in dental school as a resident. But you don't know. And so we going back to what you were saying about streamlining practice, making it efficient. That's what you want to do. Why in the heck would I want to pay $65 for a pack of endo files when I can find something just as good or even better for $25? Like, does that make any sense?
No.
But if you don't know any better, you can't do any better, and you're still in line because they got the biggest advertisement, they have the biggest banner across there, so you think that's the best. So anyway, so I drop all those tools and stuff that can save people, hundreds of thousands of dollars throughout their career, of doing endodontics, and save them a bunch of money. And so, all those kind of things about even down to the cone beam machine. I wrote a viewpoint article on CBC and endodontics, and I got a ton of hate mail, from a lot of these manufacturers that, hey, why are you saying that? And I'm saying things based in evidence-based research. It's not just because they were like, can you write it in your opinion? I'm like, I can write in my opinion, but I need to write it where it holds some weight. I'm going to give you evidence-based research based on everything I said. So it's not only going to be my opinion, this is research-based. And I can tell you, they wanted that article to go away fast. And but the people who read it, they were like, thank you for that, because they said I had to have this, or had to spend $100,000 for a cone beam machine, and all these other kind of things. And I'm like, well, the fact of the matter is, I know you want to send for a cone beam, and in certain instances, that's fine. But in endodontics, you won't see a microfracture with a cone beam. You won't.
It's something that you say that too, because I think about when dentists are setting up practices and they buy all the bells and whistles. You can't do dentistry without having all those things.
Right.
So you can get in there and do some dentistry, and once you get to a point, maybe start adding some of the things that you really like to work with.
Right.
But that is so as well. So we're going to be looking forward to your hands-on course. We'll keep an eye out for that. And when that comes out, maybe we'll have you back on the show and make some announcements. If someone wanted to get in touch with you, Dr. Short, how would they get in touch with you?
Well, the best way to get in contact with me is you can email me at dr.short@yahoo.com. I get gazillion emails all over the world about these same questions, so that's going to be a pretty slow response. But probably social media is the best. Facebook Messenger. I'm there under Dr. Rico Short. Twitter, I'm there as well. Dr. Rico Short is my Twitter handle, and also Instagram. So you can private message me or what have you, and I'm pretty efficient at getting back with you on social media versus email. But those are the best ways to contact me. Typically, I try to post when I'm speaking somewhere. So I would love if I'm ever speaking in your city or your old dental school or things like that, or you come to the ADA, Hinman, things like that. In fact, I'll be speaking at the California Dental Association in Anaheim coming up this year, and I think it's in April. So it's a 3-hour clinical. Well, no, it's not a clinical course. This is a didactic course. So it's not hands-on, but if I'm ever in your city, in your state, feel free to come by, and I can guarantee you, I'm going to teach you something you didn't know. It happens all the time. So. All
right, wonderful. Well, thank you so much for being on the show. Just bunch of knowledge, pearls of wisdom. You've been a well of knowledge. So thank you so much for coming on the show, Dr. Short.
Hey, my pleasure.
So So, this concludes another episode of the Efficient Practice Podcast. If you have an efficient practice or if you're using efficient practices to run your business better, this show is for you. So, make sure to subscribe to the show, rate and review it on iTunes, Stitcher, and many of the other major podcast mediums. And if you have not, please join our free Facebook group. It's called the Efficiency Now Network, where there are lots of dentists and dental professionals, medical professionals, and people in the healthcare arena who are sharing and trying to grow and run their businesses better. There are also specialists like Dr. Short in the group, so we would be happy for you to join. So this is Dr. Evelyn Samuel signing off for another episode. And once again, we want to thank you, Dr. Short, for being on the show.
My pleasure. Thank you for having me. I'm so excited about what you're doing, and I can see you, climbing the ladder of all the consultation people and being speaker. And I see you have your book too. So, and I do have your book. Thank you for sending me your book. It's an awesome book, and I can't wait till you write another one. And what you're doing is awesome. It's amazing, and I just can't wait to see what the future has for you as well.
Thank you so much. And we'll see you next time. And until then, so long. Bye-bye.